A few things I've noticed in observing endodontists work is that there's a tendency to keep your assistant trapped into keeping your mirror clean. And this is a very inefficient way to operate. And the problem can be solved very, very simply by developing some mirror skills that you really only need if you're using a microscope. So I'd like to review those skills with you by using 5 different examples. I can show hundreds, but a few of the details are to avoid having the assistant trapped is, of course, they need an assistant scope. You have to move the mirror away from the tooth much further than if you're just working normally. And the use of smaller mirrors can also help, and larger mirrors as well, both smaller and larger, and moving the mirror away from the area that you're working or the way you're typically used to working. Most endodontists work similar to this, and their mirror gets sprayed with the handpiece or whatever it is, the irrigation solutions, and then it requires the assistant to completely clean the mirror. But if you move the mirror away, as you can see here, it's down below the level of the dam, then the water spray or the irrigation solutions don't fog the mirror. So here's another example. You've got the mirror close to the tooth. If you move it down towards the bottom of the dam, now I can actually drill into that tooth, and I don't require the assistant to be sitting there with a strop go cleaning the mirror constantly, because the mirror is further away. And this allows you can still do a very accurate access. You have to move the microscope slightly, but you're able to actually do a lot of access type preparations without having the assistant tied to you with the strop go. Here's another example, a very critical access, trying to find in MB2, and you can see the mirror is further away towards the bottom of the rubber dam frame, and you can still be very, very accurate with what you're doing. And now the assistant doesn't have to be cleaning my mirror with the strop go. Joy is directing the suction near the handpiece, but the mirror is down near the bottom of the frame and doesn't require any cleaning at all. Here's another example of a complete case where I have to find a very narrow MB1, MB2 in a tooth with a high furca, so the accuracy of the access is very, very critical here. And as you look further in the CT, you can see that the access here is going to be critical. So you want a very, very accurate access. To do that, you have to be able to really see what you're doing while you're drilling. So this is actually how I plan the access. You plan your access before you actually go in. And I want to make an access as the diagram shows, right through the center of the tooth, and then see what we have. So that's what we planned, and that's what we ended up with. So let's take a look at how we actually did that without having the assistant be trapped in keeping my mirror constantly clean. So this is speeded up, but if you look at where I have the mirror, it's down near the bottom of the rubber dam frame. I'm going to go through this quickly, and you can kind of see where the mirror is. It's down near the bottom of the dam, and then Joy doesn't have to be sitting there with the strop go constantly cleaning. So the dam is on. That's what it looks like close to the tooth, but down near the bottom of the dam, now I can make an access, and I can do this very, very accurately, and the mirror just isn't getting dirtied by the handpiece. And here again, plenty of water. The assistant is right there suctioning, but she's free to do other things while I'm doing this. She's not stuck keeping my mirror constantly clean. Here's the initial. Now this was a very pretty calcified case, so I want to make a very accurate access, and I want to really study this very carefully before I go any further. And so your mirror, when you're studying it, is up near close to the tooth where you can see it, but then when you're drilling, it's down near the bottom of the dam. So just to kind of walk you through the case, I'm looking at minor changes in color and texture, going in with the ultrasonics, using that as kind of a drill to blow away the calcified material. And then I look at it and I can see the telltale signs of the MB2 and the line there, and I find it, and I'm actually able to get an instrument in. So the mirror is going up close to the tooth when you really need fine detail, and it's further away towards the bottom of the dam when you're actually drilling and worried about the water spray. So now I have to find the distal buccal and palatal canal, and it looks in the radiograph as though they are connected. And then when I look in there carefully, I can see the calcified pulp along that axis. So I use the ultrasonic tip, simply trough back and forth, and notice the mirror isn't getting splattered. Joy doesn't have to sit there and keep my mirror clean. And using those landmarks, I find the distal buccal canal, no problem. And I know if I trough along that axis, I will find the palatal canal as well. So I have a road map to find it. And we just go in with the ultrasound, and I can actually see where the calcified pulp is after having cleaned it up a little bit. And now there's no guesswork really being done. I know exactly where it is, and I just trough back and forth. The whole time, Joy has not had to keep my mirror clean at all. So now I have to use that road map to find the palatal canal, which is easy to do. When you look at the CT, you can see that they are connected more coronally. So I know if I trough along that axis, I'll actually get into the palatal canal. And that's exactly what I do. And using the ultrasonic, I do that and just trough along that axis, and I'm able to find it. And as you can see here, I'm trying to find the distal buccal and the palatal canal. Looks like they were joined, and then I use the ultrasonic tip to very accurately enter those canals. And it's all done without the assistant having to be chained to my mirror. So after the initial instrumentation, you can see we found all of the canals without hollowing out the root and without having the assistant sitting there constantly keeping my mirror dry or clean. The last example is a retreatment case where I have to go in, I have to take a post out, I have to find an MB2. So here again, I move the mirror away from where I'm actually drilling. And you can see it's not getting dirtied by the water spray. I can still make a very accurate access. Again, the mirror is down towards the bottom of the dam frame. And when I observe other endodontists, it seems like they're almost unaware of this capability. They have the mirror up near the tooth where it gets water sprayed, and then their assistant has to sit there constantly with the Stropco and keep the mirror dry. And it's just a very inefficient way to work. Now I've got to make a very accurate access here. I've got to drill remove the composite around the post and then remove the post without making a huge access in the tooth. And again, I'm able to do that. And not once in this procedure has Joy had a strop go to clean my mirror off. So it's a much, much more efficient way to work. And here we use an ultrasonic tip, and we go around, remove the composite from around the post. Do it very accurately. Sometimes we do this wet, sometimes we do it dry. And again, Joy isn't keeping my mirror clean here because I've moved it away. And her being at the scope, she can position that suction just ideally. And we go ahead and remove the rest of the composite around the post, and then we remove the post. I've speeded this up so that you get a better sense of the movement of the mirror. And as you can see, the mirror is not getting dirtied by the ultrasonic. It's down near the bottom of the rubber dam frame. And we just go through the procedure for removing the pulse with the ultrasonic. We take all the composite resin around the post, and then we just vibrate out the post with a scalar tip. Again, just removing some of the cement around the post. And then vibrating the post out. So you can see it's not necessary to have the assistant constantly keeping your mirror clean, except in just very precise areas where you're doing maybe a deep margin elevation. Is it necessary for the assistant to just constantly keep your mirror clean with her Stropco? So I hope this helps you understand. Takes some getting used to, moving the mirror away, but after you get used to it, you can find out that it's really very simple to do.